Hey everyone, welcome to another episode of the Coach's Corner University podcast. I am your host, Paul O'Neid, and today I am joined by someone who comes very highly recommended, I will say, Joel Proskewitz. Joel, welcome to the podcast.
Paul, thank you very much. I feel slightly embarrassed when people speak so highly about me, but I'm just here to share some information, but really appreciate you having me on, and I look forward to our conversation.
Yeah, it's my absolute pleasure. I mean, one of the, and you'll come to realize this at the end of the podcast, but something that I ask all the guests is if there was one person that you would like to see me interview on the podcast, who would it be? And your name came up and the link with McGill method and you being a spine biomechanist came up. And I was like, well, there's a mutual connection there because people may not know this, but I actually helped Stu and Brian edit their book, Gift of Injury. So I actually saw Stu a week and a half ago. He was at the Toronto Pro Show bodybuilding show. He had one of his clients, Ethan, competing.
Correct.
So I got to chat with him. How did your story kind of start? You mentioned before the call, you're a personal trainer who is in a fortunate life position now. But how did you get to that fortunate life position?
Interesting question, Paul, and a very long answer. So I'm going to try and bullet point everything. So
For sure.
I started my life as a personal trainer many years ago. That's exactly what I did. Back in South Africa, I now live in London. But back in South Africa, I, along with my then business partner, we opened up the very first personal training gym in South Africa. And
Cool.
We're going back now to like 1996, Paul, when personal training in South Africa was unheard of. And from there, I very quickly progressed to becoming a certified strength and conditioning coach. And but interestingly enough, we specialized very early on in musculoskeletal rehab because training in South Africa was very, and the medical world, funny enough, was very unregulated back in 1994. It's not like what it is today. So we were given a lot of pre and post-operative patients from our surgical colleagues. And so very early on, I got involved in a bit of a medical world, if you want to call it, alongside training my elite athletes. I was very, again, fortunate to train Olympic athletes and national and international based athletes. And Paul, I was very physically active. I was a martial artist, a bodybuilder. I did a whole bunch of things. And in South Africa in '94, we were crazy, man. We did stunts. We did whatever we could do physically to try and push our bodies and our, and our minds to the absolute edge. And I sustained some serious injuries to my spine. I fractured my spine. I got to the point in my early 20s, actually, where the back pain was disabling, and I'd actually just won a bodybuilding competition, and I'd made it to the nationals. So I'd won the regionals, and I'd made it to the nationals, and I had to pull out because the pain in my back was so significant. And I then landed up seeing a neurosurgeon in South Africa. And long story short, he told me that if I don't stop personal training and I don't stop my physical activities, I'm going to land up in a wheelchair. And he was dead serious about it. And I loved the challenge. I thought, fantastic, I'm going to prove you wrong because that's just who I am. And I proved him wrong. And I continued training and doing all of my stuff. And I came across Stu McGill's book, Low Back Disorders. And in South Africa, obviously I couldn't get hold of Stu, and because in those days we were a little bit in the dark ages. We didn't have technology like we do these days. And it was only about a year or two after I'd received the book that I immigrated to London. Sorry,
Okay.
got my dates wrong. I got the book in about 2004. And then in 2006, I immigrated to London. And when I got to London, my back was really playing up. And anyway, I decided to contact Stu via email. And I must have left about 3 or 4 emails, and he never contacted me back. And I thought, well, to hell with this. I'm South African and we pull no punches. So I got on the phone and I phoned him. And he didn't answer. And I left about 4 or 5 messages at his university, at his lab. And eventually he emailed me back and he said, Joel, he said, I'll never forget the email. I've still got it. He said, I have no idea why I'm replying to this email. He said, I literally get thousands of emails a week. And he said, but there's something about your South African tenacity that's driving me to reply to this email. And he said, look, he said, if you want to fly to Canada, I'm happy to see you, see if we can get you back on track and help you with your back. And I said, look, Stu, I've just emigrated to London. I really don't have the money. I can't fly. I said, I'll try see if I can, get the funds. And he said, well, interestingly enough, at the end of the year, I'm coming to London to speak at an orthopedics conference. So he said, if I'm free, I'm happy to give you a few minutes. Long story short, Paul, I managed to wangle my way into the orthopedics conference because you needed to be a physician to actually get in.
Mm-hmm.
So I, again, just managed to pull a couple of, favors, and I got in. And I introduced myself to Stu. And at the end of the conference, Stu said to me, he said, look, Joel, he said, I'm really tired. He said, I'll give you just a few minutes. He said, let's go sit and let's talk about your back. And those few minutes turned into 3 hours. And
Yep.
3 hours has now turned into over 20 years that I've literally been, if you want to call it, one of Stu's right-hand men. So,
He's such a unique person. Like, people don't realize, like, I have this idea that, the true change makers in the industry really live their passion. And there's a reason why he's had such a tremendous impact on the industry, is because he's so passionate about what he does. So when
absolutely.
even before you started the sentence and you were like, yeah, he sat with me for 5 minutes, I'm like, I bet he sat with him for 3 hours.
Yeah. Yeah.
And you're
That's
like,
what
oh,
happened.
yep, he sat with me for 3 hours. I was like,
Yeah.
that does not surprise me one bit. It's really interesting. You mentioned right from the beginning being exposed to orthopedic populations. Was that something that interested you, or was it just something that kind of fell into your lap and guided your process from there?
A little bit of
Or
both.
was it more so your own journey to create that link?
No, a little bit of both, Paul. So it was a little bit of a serendipitous, sort of thing that happened. But interestingly enough, I'm very, very fortunate and grateful for where I am in my career. But there's always been a part of me that really wanted to be a medical doc, always. And but it just my path didn't go down that way. So it was very interesting for me when I started to look down the route of orthopedic rehab, etc. But interestingly enough, if I look back in retrospect, I'm very glad that I've never actually qualified as a clinician or as a medical doc or a physician, because I now am quite unique. And even Stu will tell you that I'm pretty much the only guy in the world who does what I do, because I'm a trainer by education, but I live in a medical world, right? So I sit on a spinal medical team here in London. So I'm the only non-physician in the world to sit on a hospital-based medical team. I'm
Wow.
in surgery every week with my spine surgeon, right? So I'm scrubbed up. I'm with my patients or other people. I'm observing. I'm looking. I'm doing a whole host of things. So every single week I'm in theatre or in the OR, or whatever people call it around the world. And I've been afforded a phenomenal honor. I've been made an associate professor at a very top teaching university here in London, where I speak about pre and post spinal operative rehab. I talk about spinal biomechanics and how it fits into the world of pain science, funny enough. So for me, the ability to be a coach when I need to be a coach. So, for an example,
Mm-hmm.
I've just finished a 3 hour session with an individual who just wanted to come for coaching. They wanted to learn how to deadlift, how to squat, how to bench press. They wanted to learn all the accessory moves. So I didn't even do a clinical assessment, right? So I did just a very basic assessment, but the
Of
guy
course.
came
Yeah.
specifically for my coaching skills. But 99% of the time now, I'm doing clinical assessments to determine the best course of treatment for spinal patients. So for me, I'm living the best of both worlds, actually.
How do you communicate to people what you do when what you do doesn't necessarily exist?
Very interesting. For patients, the communication is very clear, concise, and very easy. For
Hmm.
non-patients or people in a social setting, it's very difficult. So I just sum it up by saying I'm a spinal rehab guy, just quite simply, right? But
Yeah.
that's all I do. I work in the world of spines. So you're a physiotherapist? No, I'm not. But yeah, it's along those lines. But
I might title the podcast Spinal Rehab Guy.
there you go. That's it. I'm a spinal rehab guy. But interestingly for me, Paul, with patients, it's very easy because first and foremost, patients have already gone through a journey to find me. So they've done their research. And, I'm really, quite honestly, I'm not a big social media guy at all. In fact, I've pulled back from social media completely over the last sort of 6, 8 months. And that's one of the reasons is that my energies have to go into being a spinal professional. And that's where I put my
Right.
energies in. I'm not a youngster anymore. I'm nearly 50 years old. So for me, my energy needs to be honed very, very specifically. And I'm obsessed about the things that I do. And I'm not obsessed about social media. So that's not where I put my energies. But with patients, it's interesting because I never take on a patient, never, unless I have a phone call with them and we discuss the expectations, and they know that I am not a a formally trained clinician. They must
Mm-hmm.
they must be very well aware that I'm actually a strength conditioning coach who happens to live in a medical world of spines. And
Mm-hmm.
so their choice to see me is very, very open and very clear, and they know exactly what they're getting themselves into. So where there's no mixed messages, I don't front myself as anyone that I'm not. I don't claim to have expertise in areas that I don't have, and so that breaks down a huge amount of barriers between a
Mm-hmm.
potential client or patient and myself. Because the refreshing thing that they always say to me is, Joel, we know that, and that's why we want to come to see you, because we've seen multiple physical therapists or we've seen multiple chiropractors and we haven't got anywhere. So we want a different set of eyes. And
Mm-hmm.
Paul, I'm very confident in my abilities, so much so that I always say to people on the phone, I can never promise you that I can get you pain free because I don't know what I'm dealing with. So until I know what I'm dealing with, I may say to you that I actually don't have the tools to assist you and I need you to see one of my surgical or one of my medical colleagues. And again, I've never had a client on the telephone ever say to me, "We don't want to come and see you." Right? So it's a because of my years, and I'll say this very openly, my years of mistakes, my years of experience, and the ability now for me to really understand the human spine because I'm obsessed about it. I'm not passionate about it. I'm obsessed. And so it's given me the confidence, it's given me the clarity of mind and of thought to be able to be very clear, concise, and upfront. And what that does is it takes away the stress of me having to fight for business. Because
I think it
if I
also,
don't,
sorry to interrupt, but it speaks to your professionalism, in my opinion, right? Like
I
if you sit
appreciate that.
across from somebody and they're wanting to work with you and you're saying, okay, that's cool, but you have to understand these things and there might be an opportunity where I can't help you, I'll refer out. To me, that's the professional thing to do. That's also the ethical thing to do. And I don't think people are comfortable enough to say that because it's like, well, if I turn away business, I'm going to go broke. There's never going to be a shortage of people who hurt their back.
No, Paul, and the funny thing is as I've grown in confidence over the years, I've and funny enough, the more confident I get, the calmer I am, the more complex
Mm.
my cases are. I don't deal very rarely, Paul. Do I deal with the guy who is the back mechanic patient? Because those guys usually get themselves better by using the book because the book's so good, right?
Hmm.
So on that basis, I really get to see some very, very complex cases. And when you're dealing with phenomenally complex cases and they require, very clear thought pathways, you learn over time to be able to calm yourself. You learn to be able to understand the patient. And in fact, during my 3 hour assessments, I'm never stressed. I'm never having to justify or verify a prescription. If I finish a 3 hour assessment and I say to the patient, I don't want you doing any exercise, what I want you doing is going to see my surgical colleague because I believe this is where you need to go, they all turn around and say, brilliant, that's what I'm after. So I'm never under any pressure to justify my existence for that particular patient, which again has been blood, sweat, and tears to get there, Paul. Blood, it's been years. Yeah.
For sure. Um, this is a question that I wasn't anticipating asking, but you hit on a word or a term that I think in this day and age is a little bit taboo, and it's pain science. So pain science is something that is being talked about relentlessly in the social media space, in the clinical space, in the training space. And you work in a very interesting intersection between biomechanics and pain science. Most people operate in biomechanics or pain science. I would love for you to provide your context on perhaps the intersection between those two areas of science.
They're closely intertwined, man. They're not separate entities because when a human being walks in, plain and simple, right? You're dealing with emotions. You're dealing with some people are, uh, highly anxious individuals. Other people are, hey man, I got a little bit of back pain, but for me, it's nothing. I can handle the pain. Um, but the key component is this, Paul. I dismiss nothing, right? So when I was on social media, I had a hashtag. It was called Everything Matters, right? Because everything matters for me. So the way someone stands when they walk in, for me, that's pain science because they're projecting their emotions and, are they in pain? Are they not in pain? And me as a human being, I need to pick up on that. I need to recognize those patterns. And if I have the ability to have pattern recognition, I can speak to them in a certain way. So, for example, a lot of physical therapists are under immense pressure. And I'm not against the world of physical therapy, not at all. In fact, I've got physical therapists at my facility that I need because they've got certain skills I don't have. But interestingly, a lot of the physiotherapists on social media who are espousing pain science, I understand why they're doing it over biomechanics because they're in a very difficult position because they see a patient, they've maybe got 25 or 30 minutes with that patient. The patient doesn't have a lot of disposable income to spend privately. They're either under insurance or there's a government based system here in the UK where people are on national health, and those physios get to see a very different demographic to me, massively different, right? The people are anxious. Most of them aren't exercising. Maybe they're not eating very well. Maybe they're not sleeping well. They haven't been exposed to all this wonderful health information. So I get when a physio says I need to potentially counsel them on those factors prior to trying, getting involved in the biomechanics of movement. For me, it's different because your barrier to entry to come and see me is two things. It's time and money, plain and simple, right? Because you need to afford to come and see me and you need to have the time to come and see me. And the majority of people who come to see me, man, their sleep is perfect, right? Their eating is good. They train well. They don't have massive, mental anxiety. So I don't need to counsel them too much on pain science. So I have the luxury of being able to spend more time on the mechanical aspect of what's going on. However, I don't speak to everyone the same. I don't present myself the same to everyone, right? So if someone comes in, I have an innate ability and probably something that I've trained significantly over the years to recognize who that person is. And I can change, a little bit of a chameleon, right? I can change the way I interact with them to make them feel very comfortable. So for me, that is my element of pain science, is listening to their story, understanding what they're saying, being phenomenally empathetic to that particular individual. And Paul, I had a significant event in my life 4 years ago, that changed my empathy for a patient. I went through 7 spine surgeries in 12 months, right? So here's one of my.
Holy shit.
So from June 2020 to June 21, I had 7 phenomenally large spine surgeries. I was disabled, right? And so now when I sit in a consult with a patient, I don't just sit there as a McGill guy or a spine guy, right? I sit there as a
Mhm.
patient. So when someone says to me, Joel, I don't know whether you actually understand what sciatic pain is. I'm like, well, let me tell you. So from a pain science perspective, okay, there's
Yeah,
buy-in straight away, Paul. Buy-in straight away
100%.
because so that's how I see it. I've never been in a position of where I need to counsel people about their relationships or their interactions with their family members or the fact that they don't sleep well, because that's not my demographic. But I don't dismiss that because I understand how other people work.
I would venture a guess to say that the majority of your time is spent on education with your clients.
Paul, I'm going to answer that question by going back to February of 2022. There was a paper that came out by a great spinal surgeon and his group from Stanford, Matthew Smuck. And the paper is entitled,
Great name.
yeah, the paper is entitled um, Low Back Pain, What Do Patients Really Want? The conclusion of the paper is that patients want a diagnosis. They want to know what's going on, plain and simple, right? So, yes, they want to resolve and yes, they want to be pain free, but they actually want to know what's going on. So, Paul, the interesting thing is my ultimate goal before getting people pain free is to educate them about actually what is going on. You know, I've had people turn around to me, and it happens all the time. All the time. It's nothing new and it's nothing unique in my world, where people say, Joel, if all I walk away with today is an understanding of what's going on so that I don't think I'm going mental, right? And I don't think I'm going crazy, that will take away 50%, 80% of my anxiety. And then I know what I need to do to deal with it.
That is so shocking to me.
I'm like,
And I understand the rationale. I understand the rationale, but I've always been of the mind that, like, if the outcome is the same and I'm going to have to rehab it, I don't really care what name you attach to it. And this was kind of the thought process when I was working in disability. I would actually see a tremendous regression in people's conditions when they had a diagnosis attached to it, because now their identity shifts, right? So
and
I would think that having a diagnosis would shift that and kind of,
yeah, but my patient population, they've seen multiple people and they've been told there's nothing wrong with you, carry on. It's a little bit of muscular pain. It'll be gone in 3 weeks, or it's this or it's that. So what happens is by the time they come to see me, they're so confused, Paul. They just want to know what's going on, right? So because no one has actually spent time doing a proper mechanical assessment, and you know, the interesting thing is in assessments, Paul, right? We can only test for normal versus abnormal responses to any given test, right? So if I perform a test, if there's no pain or it's okay, it's a normal response. We know what that is, right? We've measured that. But if there's an abnormal response, we can hypothesize and determine that it's potentially this or that because of experience and because of our, you know, a lot of research behind certain pain generators. But we need scans to actually confirm, because scans are evidence. And it's the same thing now. When I was on social media a year ago, whatever it was, you know, you would have so many people turning around saying scans are rubbish. You don't need scans, right? Well, hold on a second. Don't be so dismissive of something that is the only thing that is objective evidence as to what is going on structurally. Now, that doesn't, what I didn't say, I never once said that that's what's causing your pain. I said
right.
that
Yes,
is
for
what
sure.
is evidence of a structural thing, but that structural thing may not be causing your pain. So, again, when I disclose all of this and I educate the patient, and I've never had a person say to me, never say, I think I've only ever had one person who was very anxious and she didn't want to see her scans. But in the thousands of people that I've seen, bar her, every single person has said to me, Joel, please explain my scans. I don't catastrophize. I don't tell them that, this is falling apart. I explain very professionally what's going on and how it correlates to their abnormal responses in their tests. And they sit there and it's like, boom, the lights come on. And they say, I got it. Now that I got that, right, now let's talk the treatment options. Because how do you treat something, Paul, if you don't know what the diagnosis is? Makes no sense.
Totally.
I'm going to answer two questions in that conversation. The first question is, I totally get what you mean when someone said, you've got a torn meniscus. So, Paul, it comes down to the delivery. How do you deliver that, right? So I would say I have really, funny enough, through the world of personal training, because as a trainer, and I was a trainer for 20 something years, right? I would work anywhere between 50 to 60 sessions a week. And that's what I did genuinely. That's what I did for about 20 years. Okay.
Oh my God.
I kid you not. I was doing, between 8 and 10 sessions a day. And I built up a phenomenal skill set of learning how to speak to different people, talking, multi-billionaire CEOs or entrepreneurs to, just the guy who's saving up every week just to come and have one session a week because that's what he wants to do. So I built up a huge skill set, right? And again, in my day, we didn't have social media. All we had was Muscle and Fitness magazine or a couple of NSCA journals that we'd go home and read or we'd just immerse ourselves in the encyclopedia of bodybuilding. And so our skill set was trained phenomenally well, I believe, during those years compared to today, because people just can waste their time listening to a whole bunch of information and not actually honing their skills. So the way that I deliver their diagnosis, Paul, is very different, man. So I'm very, very careful with my words. I'm extremely aware of who that individual is. I can pick up if that individual is fragile. I'm not going to turn around and tell them about every damn incidental finding on that scan, right? So, and again, I never tell them the scan until I've got the outcome of my assessment and we can give them a package, right? And when you deliver that, I'm not just delivering a soundbite of information. Oh, look at your disc. You've got a massive disc bulge, and then the guy freaks out. It's like, let me just explain what's going on. So can you see that possibly the disc bulge is seemingly worse on your scan, but your clinical tests weren't that abnormal? I get it. So the scan is just showing me that it's this. Yeah. So again, it's how you deliver it. And that has come over years of mistakes and now experience. So that's the first point I wanted to suggest. Paul, the second point with regards to virtual surgery, I've slightly moved down a different route from back mechanic, right? Because I'm dealing in such traumatic cases these days, a lot of post-operative patients, my surgeons are sending me patients, etc. So that when people do come in, the first goal for me is to determine what their treatment option is, right? So, for example, when we diagnose and we get a diagnosis, which comes from understanding history and checking their scans and doing examinations, etc., we have three treatment options afforded to us, or a combination thereof, Paul. Treatment options are as follows. It's conservative, which is training, movement modification, physical therapy, chiropractics, whatever. It's medical, which is a pharmacological involvement, either oral drugs or even spinal injections, or finally it's surgical, or it can be a combination of all of them, right? We don't know. But the goal for me is, before I even discuss treatment, I need to understand what I'm dealing with. Now, because I am, and I hope this doesn't come across as arrogance, right? Because I'm not, but because I have such an immense experience with the spine, right? I'll tell you a surgical patient within 5 seconds of seeing them. And they walk into my office, I'll tell you straight away that this is not a conservative or a medical thing, right? Now, I don't suggest surgery because I'm not allowed to. It's not my field of expertise. I'm not a surgeon. But I will assess them and I will say to them, I highly recommend that you have a consultation with one of my surgical colleagues or a surgeon of your choice. I'm more than happy to sit in on that consultation with you on Zoom and I can discuss my findings with your surgeon. But I genuinely think that this is where you need to go. Paul, I've seen many people for surgical consultations that have landed up having surgery, which have actually saved them in the long run.
Oh, I don't doubt it. I don't doubt it. I think the coolest part about this conversation is how you continue to allude to the ability to know what's going on. You use that term a number of times, like knowing what you're dealing with.
Yeah,
And for me, the way I internalize that is, well, we have function, then we have diagnostics, and we have history. And we need to be able to put all of these things together to communicate a big picture to this client so that they can make the best decisions for themselves, right? Because
absolutely.
again, I'm a coach, we're not clinicians, so we can't recommend anything,
No,
but we can do the best job that we can to educate that client on the direction that they might benefit most from. I
absolutely,
love
man.
that.
Yeah.
in your in your experience, I'm sure dealing with the number of clients that you've dealt with, I'm curious how you balance your associate professorship, clinical responsibilities, client care. Because one thing that I'm always curious about, as someone who myself, I have coaching clients, I have mentorship clients, and I have an education company. I'm always curious about how people manage time, but also manage their own energy levels within this.
Interesting, Paul. It's a huge question, and to give it some thought, because I hate just answering. I like sort of letting things simmer in my head a little bit. Otherwise,
You can pause as long as you want. This
yeah.
podcast can be edited.
No, I get it, man. But I'm pretty confident with where I am in my head, so I'll get straight to it. I got so used to doing between 50 and 60 hours of personal training for 20 years, right? That yeah, and I kid you not, you speak to any one of my trainers who works for me at Performance RX, they will tell you, right? I've got trainers there that have been with me for for 20 years, and they'll tell you in no uncertain terms, man, I was banging out 8-10 sessions a day, 6 days a week. So when I decided to go into the spine world full time, I went from seeing 10 hours of sessions a day to one assessment a day, which is 3 hours. So for me, it was like, wow, my world has opened up completely, right? My day has opened up completely. Now I can train. Now I can do a whole host of things. So, how I manage everything, Paul, is the burden is not just on me. I'm very grateful. I have a phenomenal team. I've built up a great team around me. So at Performance RX, I've got 6 trainers who work for Performance RX. They're amazing. They are absolutely amazing. They are highly educated, great trainers that after I've done my assessment, if any client of mine or patient of mine wants to then do the continued training, they just work with one of my trainers. So that takes that burden off me, right? I do have some patients and some clients who want to work exclusively with me, which I do, right? But my day is not an 8-hour day of just training anymore. So that's number one. The associate professorship is, I do terms. So about 3 or 4 times a year, I present 2 courses. So that doesn't take up a huge amount of my time. So that fits in just very nicely with what I do at UCL. And client care that's what takes up my time. So after I've done assessments, I've got to come home, I've got to write up their clinical letter, I've got to write up if I need to join any Zoom calls with my surgeon or my surgical colleagues. That's what I do. But Paul, for me, it's very easily managed just because my obsession with what I do and my obsession with wanting to improve who I am as a spinal rehab guy every single day. it's just part and parcel. I don't think of it. It's not a conscious thing where I turn around and say, "Oh, damn, I've got a hectic day here." It's like, okay, good. What can I learn today, and what can I be better at? I'm highly reflective, and I'm very, very
Mhm.
hard on myself as a human being.
Can you give me a little bit of a background on how, obviously, you started as a personal trainer? You mentioned linking up with McGill. At what point did Performance RX start, grow, and all of these other opportunities kind of manifest themselves?
I immigrated to the UK in 2006. I was a personal trainer then, and I was a freelance trainer working at a gym. Now, it was difficult for me because I came from my own gym, private training gym that I started in South Africa. So I'm now a freelance guy that's just, paying an hourly rent. And I'm in this gym and I work for 6 months, and I'm this foreigner who lands up in the UK, and I'm the busiest trainer there within 6 months, within weeks of actually being there, that I didn't realize that the other trainers, right, who were other freelancers, were thinking that I was planning a coup on stealing all of their clients. I'm like, really? I've never had to deal with this in my entire life. Anyway, I go on holiday. So I'm here in the UK for 6 months. I go back to South Africa for a December holiday. I come back and I come back to an email, because in those days, we didn't have email on our phone. I come back and I turn on my computer and there's an email, and they've kicked me out of the gym. And I'm like, "You kicked me out for what reason?" So I phone and I say, "Listen, guys, I'm starting work tomorrow. I've got 10 sessions. I've got 60 sessions. You're making a fortune from me every week." "No, the other trainers here are threatened by you. They don't like you, whatever else. And goodbye, you're gone." Anyway, I found another gym to work at, and far more, tolerable people, very nice people. In fact, they welcomed me with open arms. I worked there for an extended period of time, and then I actually took over the gym, right? Because I was, again, by far the busiest trainer there. And I took over the gym and I spent a fortune, Paul, renovating the gym and doing it all up. And a year later, the owner of the building threw everyone out, right? So I'm stuck on the
Oh
literally
my gosh.
stuck on the street, right? Again. So I said, this is it. I'm done. I'm going to find my own place. And it took me about a year. So I was doing freelance work. And it took me a year, and I found premises for Performance RX. And I'll never forget, Stu and I had a long conversation on the phone. And, because I phoned him when I got kicked out of the gym, because I was already at that stage starting to do a lot of back stuff. And I said, "Stu, I've made a decision. I'm going to go full time into spines, and I'm going to find a gym, and I'm going to take a team with me, and I'm going to build them up." And open Performance RX. And we started literally with not a client. And within 3 months, 10 trainers, all working exclusively for Performance RX, really busy. And we keep very quiet. We're not on social media. I've never had to
Yeah.
nothing at all. We just quietly get on with our stuff. And I've got an amazing team, Paul. So the team help me out. They allow me to be who I am massively. And I've got a PA. I think I don't know if you've ever dealt with her. She's unbelievable. And so again, she looks after all of my diary, my initial client contact. I don't have to do any of that. And again, phenomenally grateful that I've got such an amazing team. Personal life, um, unfortunately now my marriage has, unfortunately, we've parted ways. However, my ex-wife and I are on very, very good terms, and she was phenomenally instrumental in building up Performance RX. And that's why I'm saying it now, because if Performance RX would not be what it is, if it wasn't for her absolutely committed effort to it. And she's still involved. She's an amazing individual. And she again was very instrumental in allowing me to be who I needed to be. So
It's really refreshing to hear you speak about, the role that your partner at the time played in building your business. And I'm very open about the fact that my companies would not be where they are without my wife. Like
Oh, man.
when I met my wife, I was actually coming off of a divorce myself,
Okay.
and we were together for just under a year when she came on as an assistant coach.
Okay.
Within 6 months of her coming on as an assistant coach, I brought her on as co-owner. We had three other coaches working for us. This is now 2 years after she joined up. We now have 7 total coaches with us.
Amazing.
And I attribute all of it to her and her support. And she's a phenomenal coach in her own right. Uh, and it's funny, she lets me do what I want to do. We have so many conversations about, she just wants to coach clients. That's what she wants to do. She doesn't want to do the education. She doesn't want to do the mentorships. Doesn't care to do the podcasts and things like that. She'll do them periodically when
Yeah.
I kind of entice her to do it. But for her, it's all about coaching the clients. And I'm really glad that you shared that, because having somebody with you along this journey, whether it's your husband or your wife or your partner, it just makes everything so much easier,
Oh man, yeah, and
right?
and and again, and that's why I'm not afraid to publicly say it, right? Because well, the truth is, we're not together anymore, but that's just from a marriage perspective. But she's still involved in the business, and there's no ways I could ever take full credit for what Performance RX is and what it's allowed me to do without mentioning her. Oh, there's that goes without saying.
Talk to me about the spinal exchange.
The spine exchange.
Yeah, the spine exchange.
Hmm.
What is the spine exchange?
The spine exchange was born out of a little bit of a need, probably a bit of a selfish need, Paul. It's morphed quite a lot, and it's still in the process of. And it was born out of my want to share my post spine surgery story with other spine surgery patients. So to not be a clinician, but to be a patient, it was a community. So it started off as just a couple of Zoom calls, a few times a month, and where I'd have a whole different bunch of patients, my patients, people who were not my patients, and we would just talk about what happened. How we feeling? Are we a little bit down? What happened? We were a little bit aggravated with some of the staff at the hospital, whatever. And it just grew and grew and grew. Right, it became massive, and then I decided to create something a little bit more of an online resource for spine surgery patients where they could get onto the Spine Exchange and they could view verified information. So not just Googling it or getting onto YouTube and, hearing some youngster who's actually never had spine surgery before talking about the do's and the don'ts. And I made videos about, how to look after your spine, pre-surgery, post-surgery, all the different surgical procedures. I used all of these models and all of my surgical models as well. And but Paul, what's actually happening with the Spine Exchange now is we're expanding it to cover everything and anything to do with spines. So we are upgrading our YouTube channel as we speak. And we are going to include everything to do with spinal pathologies, rehabilitation. The only thing it's never going to be, Paul, because that's against my philosophy, it will never be prescriptive. So it's an information portal, non prescriptive. So, in other words, you will never come onto the Spine Exchange and see, do this to cure your sciatica. Okay. Because that's not what I do and that's not who I am. Right. But you'll get on there and the video will say, what is sciatica? Right? And then we'll describe all of the differences about, what sciatica is. It does it relate to the spine? Could it relate to the knee? Could it relate to a whole host of things, right? And so that's what the Spine Exchange is evolving into. It's a huge project. And again, I've got a team and I've got a new team and we're building things up.
You know how I know you're not a social media guy? It's because you won't do the 5 tips to get rid of your sciatica.
No chance.
And
No chance.
that's going to be my next question, is like the concept of building a successful and scaling business without being on social media is blasphemous these days. Talk to me a little bit about why you stepped away and whether or not you're going to step back into it now with, the spine exchange pivoting and looking in a new direction.
Uh, Great question. Um, Paul, I suppose I pulled away because of what I said earlier. I have a limited amount of energy, as does every human being, right, until we crash. And my goal is to put my energy into things that make me better so that my patients can improve. That's my ultimate goal. I'll always work backwards. I always start with the end in mind, as Stephen Covey said in The Seven Habits of Highly Effective People. So, with that in mind, I came to a realization that when I put any social media post up, the majority of the people who are going to be looking at that are going to be other clinicians or other, coaches, and that's not my target market now, right? Maybe if I was doing education, I totally get it, right? But my target market are the people who need me. Okay, now it's not to say that they're not on social media, but there's so much noise, Paul, right? About do this to fix your sciatica, do this to fix your back pain. Man, first and foremost, let's be quite honest, right? I don't have the Tom Cruise face to, influence on social media.
Oh, you're selling yourself short, buddy.
No, but in all honesty, the whole thing is I'm just not a social media guy because I don't have it in me to turn around and say, do this to fix your back pain. Because I may have seen a client and could have been the exact thing that made them worse. So who am I
Hmm.
then to say with definitive authority that this is what you need to do? So I'm just not prepared to sell myself like that. Now, it's a different story if you're a coach and you're saying, listen, if you potentially do a preacher curl this way, or you change the mechanics, or you change the lever arm, okay, this could potentially happen because you're imparting information, right? You're not telling them
Right.
do it this way because it's better. You're saying this is a comparison. Now, if I get on social media and I say, listen, this is a spine, that's your disc. This is a facet joint, right? And this is what can potentially happen. I don't mind doing that, right? My issue is the energy for me to create that is much better spent currently in self development and development for my patients. Now, that may
Couldn't
change.
agree more.
That may change. And in 6 months' time, I may turn around and say, you know what, I'm now ready to actually impart this information via the spine exchange. And that's where I'm going to put my energies. So that's it's nothing more complex than that, man. And also, to be honest, right? No insulting anyone, but I do. There's a saying that Mark Twain had, and the saying is, "Never argue with stupid people because they will pull you down to their level and beat you." And what I don't want to do, Paul, is I don't want to get on social media and have some youngster, okay, who thinks because he's been on some course where they maybe spoke badly about McGill or whatever else, come on there and start questioning the information I'm putting up. Because I'll tell you why. Listen, kiddo, not you, the kid, right? You don't have as much
Hmm.
experience as me. You don't sit on a spinal medical team like me. You don't have direct access to surgeons the way that I do, right? So, who are you to come on social media and tell me that my information is right, wrong, or whatever? So, I don't feel that I'm going to give you the privilege of engaging with you. And again, that may come across arrogant, but that's a protective mechanism for both me and my patients.
I think the intent behind that is completely fair in terms of protecting your energy because honestly, I look at social media like a game. I very much I don't put any stock in my own self-worth associated with social media. To me,
Sure.
it's part of the job. Like I got to be on there. I got to promote my stuff. Um, I also take a very similar approach to you. If anyone's ever watched any of my YouTube content, it's here's all the information, do with it with what you wish. But I've also taken the stance of what gets you in the door doesn't have to be what keeps you in the room. So
Correct.
I'm totally okay with these clickbait topics. And like, my last video was stop wasting your time with supplements. But the whole video was about supplements that actually improve performance.
Fair
And
enough.
And that for me, it got you in the door. It got you in the door, and hopefully the information keeps you in the room. And that's how I've come to manage it. As far as I get it a lot because I've been a strength and conditioning coach for the better part almost 20 years, 19 years. And again, I have the postgraduate education. I have 2 master's degrees. I know what I'm talking about. I know how to read research. And I actually find it really funny when these quote unquote evidence-based practitioners will strictly abide by whatever the research says, when I know for a fact that whatever this research says cannot even begin to be applied in the real world. An
Correct.
example would be, there was a study that came out that said a specific posture was better for aerobic recovery. And it was like bent over in a kneeling position or something like that. And I was like, if I ever saw one of my athletes bent over in a kneeling position trying to recover, I would throw them out of the weight room.
Exactly, man.
Because if you bend over on a field, you're done.
Yeah, you're done.
And that's one of the examples that I always kind of come to is
No, but you're right.
the education doesn't matter without the experience. And in my opinion, experience over time is its own education.
Paul, let me tell you something. I'm gonna to publicly tell you, I'm gonna steal that from you. It is education. Sorry, experience over time is education, right? I've made so many mistakes. I'm sure you've made so many mistakes,
Oh,
and
countless.
countless, and the reflection on that, and then the ability to try and change that to make sure you don't do that again, right? That's experience. I always say that people always say to me, Joel, what new course should I go on? What should I go learn? What should I do this? And I'll turn around and I'll say, simple, the course that you just did, just wait 6 months, go practice and go back and do that same course again, because you will be a different practitioner. And as a different
Yep.
practitioner, you're going to see the course differently. Do you know, Paul, I'm the only guy in the world, right, before I started teaching with Stu, that did McGill 1, the first level course, okay, in excess of, I think it was 12 or 13 times, okay, under
Oh
my
my
own volition,
gosh.
where I paid for that on my own. Eventually, Stu just turned around to me and he said, Joel, do me a favor, just come teach with me, and that's how we well, he said, you've done this course more than any other person ever. And because every single time I did the course, right, I was a different practitioner. So I learned something different, because the third time I did the course, I thought, God, you know what? I've just seen a patient that what Stu just said that relates to. But the first time I did it, I'd never seen a patient that had that problem. So I couldn't quite understand it in my head. So don't go and do a million different courses, right? Do one thing and get really good at it, man. Because as you've just said, right, experience over time is your education. And that's what and
I love it. Yeah.
nothing, never a truer word said.
Well, I appreciate it. If I guess podcast done, we'll see you guys later. I also want to highlight the fact that if you're making mistakes, it's totally okay to acknowledge that you made mistakes or that you were wrong. And that's the only, like, that level of humility, I think, is lost on a lot of people. But it's a true hallmark of a professional to admit, hey, I was wrong. Let's change our outlook. Let's change our approach, and let's try to come back at this in another way. And I think I have never had a client leave when I've said, hey, we didn't peak well for that competition. That's on me. Let's try something new next time. That was like, cool. Okay. It's
Exactly,
never
man.
like, you suck, blah, blah, blah. Because the other option is, you didn't do your job. My peak was perfect and you didn't execute as far as the athletes. Like, well, where's the ownership there? Where's the accountability? And I think as coaches, we really need to be, to have that level of humility. I think it's important.
Absolutely, man. Absolutely. And again, Paul, that's the whole thing, is that, we are humans, we make mistakes. It's how we reflect upon those mistakes, and what systems do we put in place to make sure that we don't repeat that. And if we have that ability and we are reflective about what we do, then the path to improvement opens up. And people turn around and I don't want to get involved in the subject too much, but Stu and I have discussed it at great length. So many people are so critical of Stu and his thinking and what he says and what he does on podcasts. And the interesting thing is, a lot of these people have never seen how we practice. People have this
Yeah.
perception, right? I'll just give it to you very, very briefly and simply. People have this perception that because I work with Stu, right, when they walk into my office, they're always going to get the big three in a walking program, or they're going to get, spine hygiene, never bend your spine. I'm like, what are you talking about? I'm like, where in the world did you have that idea? That's been perpetuated by people that have never seen me practice.
Hmm.
That's junk, right? I don't, I'll never, people say, can I bend my spine? Well, I don't know. Can you? I'll throw the question back. Oh, sure, I can.
Great answer.
Well, then bend your spine. So what are you asking me for? I'm like, what do you think? Because our research showed us that, multiple repetitions of flexion under load is a disc herniation mechanism. I never said you don't bend your spine. Now, if you bend your spine and your leg goes numb, or you get the searing pain down the back of your leg, hey, hold on a second, boom, time out. What we may need to do is we may need to modify that movement while your body heals, so that you don't continually sensitize and or further cause more issues. But
Right.
must you walk around like a flippin' robot for the rest of your life? Man, I've had 7 spine surgeries. I move my spine more normally than most of my patients. So it makes no sense, because people get this bite-sized information and they come to a conclusion based on that. And they're so definitive in their conclusion. But all of these guys that speak about McGill and everything else, on their social media platforms, they've never seen me practice. They've never spoken to me in
Hmm.
person. They don't know who I
Of
am,
course.
right? So again, people are very quick to judge.
Couldn't agree
Judge based
more.
on what, man?
So I like to finish my podcast with some quick hit questions.
Sure.
Bit of silliness. What's been your biggest win as a practitioner?
My spine surgeries, 100% my
7
spine
of them.
surgeries. 7 of them.
Yeah.
If I had my life back over again, would I do them all again? 100%. Would I change a single thing? No ways.
What's been the biggest mistake that you've made that you regret?
What's the biggest mistake that I've made that I regret? Um, Tough one, because every mistake I've ever made, I've appreciated, and I've never regretted it, because it's made me a better practitioner.
I like that answer. I'll allow it. Um, what does your training look like these days?
Training better now than I ever have in my entire life, because my spine surgeon saved my spine 100%. However, I look after it. I do weight training 4 days a week, hypertrophy, bodybuilding. That's my gig. I'm not a power lifter. I'm not interested in deadlifting, PRs. That's not my thing. And I do cardio twice a week. And consistency for me now is absolute key. I'm 3 years out post my last surgery. I'm loving training more than I've ever in my entire life, and I'm obsessed about it. So there you have it.
Who are your who is your Mount Rushmore of spine practitioners?
Who
So
is
top 4 people.
top 4 people of spine practitioners?
Yeah. Whether surgeons, clinicians, anyone.
I have a gentleman. I can't name names, right? They're part of my team, right? But I have a gentleman. He's my rheumatologist. Unbelievable, right? Unbelievable. I have another gentleman who is my pain consultant, and he thinks completely out of the box. He's incredible. I have one particular surgeon, right? Who is, for me, he's my lifesaver. He's my surgeon, right? And above any other surgeon that I've ever dealt with, man, he's my go-to guy. And then obviously Stu.
I love it. And the last question that you knew was coming: who's one person you'd like to see me interview on the podcast? But the caveat is you have to help me get them on.
I have to help you get them on. One person. Let me think. I've got. Well, first and foremost, right? Have you interviewed Stu?
I haven't. I asked him over the weekend though, so we'll
Okay,
get him
so
on.
I can't. So I can't.
Can't say Stu.
I can't say Stu. Okay. Um, Let me think about this, right? Because I have quite a few people who would be very interesting. But again, let me ask you this, and you can tell me. Justin Kavanagh.
Justin is actually a friend of mine, and he's been on the podcast.
He's been on the podcast. Okay,
He's
so
been on the podcast.
all right. So I would probably say to you, um, I have a very interesting person for you.
Okay.
He's not known at all, right? No one's ever heard of him. But this guy will out-train any individual that I know. He's the toughest, most mentally resilient, most phenomenally physically dangerous individual that I have the pleasure of calling my associate and one of my best friends. He's never been on a podcast in his entire life. He doesn't have
So we're
social
gonna
media.
get him on mine.
He doesn't have
Okay,
social
perfect.
media. Okay. And can I say
Okay.
his name?
Absolutely.
His name is Neil Broadbent. Neil Broadbent is a mixed martial artist. He's a kung fu practitioner. He's a jiu-jitsu player. He won the European Jiu-Jitsu Championships, where a week before he did his knee, he could hardly walk. Okay. The dude is a outdoors. I don't know what you even call them these days. The dude can make a house from a tree with a Swiss Army knife. He's like a real life MacGyver. Okay.
He's a man.
He's a man. He's a man, right? But Paul, he's my second in charge at Performance RX. And this dude is unbelievable. Neil
Well,
Broadbent.
that's enough of a recommendation if I've ever heard one.
Yeah.
Any parting words of wisdom for the audience? A thought that you would like to leave them with?
Yeah, I would. Absolutely. Your audience are coaches. Okay. And what I would say is I'm still a coach. Even though I live in a medical world, I do not regard myself as a clinician. I regard myself as a coach first. And the best way to be a great coach is to coach, right? Forget all the fluff, forget all the stuff that distracts you, right? Just be a coach and put all of your energy into being the best coach that you can be, man. And you're going to make mistakes. But as you said, Paul, right? Experience is our education, right? If you're a coach, you don't want to coach for an hour a day. Get on that floor, get dirty, get in the trenches, go do all the stuff that we used to do that the new coaches aren't doing. You know, I laugh when someone's been a personal trainer for 3 years and now they tell you how to make $100,000 business. I'm like, really? You want to make $100,000 business as a trainer? Train. So that's my word. That's my thought to the coaches out there, man. You want to be a great coach? Go coach.
I love it. I will have links to where everyone can find you in the show notes. Thank you, Joel, so much for joining me. Everyone, thank you so much for listening. Please make sure to like, share, subscribe, ring the bell, and we'll catch you on the next one.